Hello, I'm Dr. Susan Marcel. Welcome. Thank you for joining us today for the ACO, a different kind of psychiatry webinar case presentation. I'm happy to introduce to you our speaker, my friend and colleague, Dr. Alberto Foglia, who will be joining us today. And he is going to be presenting Healing Dyspareunia, a young woman's journey to pain-free intimacy through therapy. So welcome, Dr. Foglia.
Thank you, Dr. Marcel. I'm very happy to be here.
Yeah, very glad to be here with you. So Dr. Foglia is a board-certified psychiatrist by the Swiss Board of Psychiatry and in medical orgonomy from the American College of Orgonomy. And he has a medical psychiatric orgone therapy practice in Lugano, Switzerland. He treats infants, children, and adults. He's written several articles about medicine, psychiatry, and orgonomy in several scientific journals, including the Journal of Orgonomy. So before we start today, I would like to just ask our audience, if you have any questions, please put them in the Q&A section at the bottom of your screen. We will get to them at the end. So any questions or comments, we would welcome that back and forth discussion. Dr. Foglia, tell me, how did you decide to present this topic?
I decided to bring this case because it's a very well demonstration of the uniqueness of medical organ therapy in the approach of the mind-body relationship. Dyspareunia is a psychic and somatic disease, an emotional and a physical disease, other than the organic cases. There can be dyspareunia because of tumor, because of inflammation, because of infection. But the majority of the cases are so-called psychosomatic. And this is the case I am presenting here. My patient came to me when she was 24 years old, and she came because of bulimia.
Okay. So what treatment approach did you use when she first came to you?
Before to talk about medical organ therapy, I would like to say very quickly how other therapies work on dyspareunia. So there are the psychological behavioral approach that tries with words and education to arrive to the hidden emotion behind dyspareunia. But we will see this emotion is far back in the infancy of the patient and is not verbal, it is pre-verbal. So you cannot reach it with words and even with education. The other approach is this medical, somatic, physical approach. Because the disorder is due to a contraction of the pelvic floor and the vagina that make sexual life impossible, they treat this contraction with exercises, gymnastics, physiotherapy, even electrical and ultrasound application. But they don't get the emotion.
So
Medical organ therapy simultaneously treat the body and the mind of this disease. And the origin is a very primitive emotion of the child, emotion expressed exactly in the pelvis. We will see that.
I see. Okay. So for me and for our audience, can you tell us more about medical orgone therapy?
Yes, medical organ therapy uses three tools to reach the unconscious, the vegetative hidden life of the patient. The character analysis, the muscular work, the work on the muscles that can be indirect, asking them to roll the eyes, to hit, to kick, or direct through pressure of the tense muscle. And the third tool is enhancing respiration. If you take the patient on the couch and you instruct him to roll his eyes, to kick, to hit, to move his face, and the way he reacts to this instruction reveals you their character. They can be shy, they can be arrogant, they can be passive, they can be submissive, etc., etc., etc.
So can you tell us more with your patient? Like, how did you address the character and character analysis?
When she came to me, she was frozen, immobile, inexpressive. And the way character analysis work is to point out to the patient this attitude. So I continually pointed out that, and that brought to expression of crying and misery that lasted several sessions. At the 84th session, however, she began to rebel against my instructions. These instructions are stupid, I don't want to do it, I don't want to kick, I don't want to hit, etc., etc. And this brought a new feeling in her, rage. And this rage was not only against my instructions, it was against the instructions that her mother made to her, revealing a very difficult relationship with a very difficult mother.
Yeah, wow. So 84 sessions, I mean, that's a lot. So tell us about, like, the muscular work. What did you do as far as addressing that in her?
Yes, she was inexpressive, immobile, but also in her body. She was stiff, she was frozen, she was blocked. And by moving, children react to pain and suffering by armoring. They armor the character, which becomes stiff in her mind, but also in the body becomes stiff, become contracted. And she was contracted, inexpressive, blocked and immobile. When rage came into therapy after the 84th session, she began and she could express rage physically by moving her body. So in this moment, body and mind were together. Rage and rageous movements. And these, until the 200th session, were then bulimia dissolved.
200 sessions, my goodness. Wow, wow. That's determination. And you also mentioned, the third approach was, breathing or her respiration. So how did you address that with her?
Yes, respiration can be a very big problem for certain patients. It can be the central problem. They don't breathe or they are blocked in their breathing. She never had problems by breathing, so it was never an issue in therapy with her.
So from the beginning, she was able to breathe because many patients don't have that. They're very big trouble trying to take a big deep breath in. They hold their chest very frozen. So she was able to do that.
She decided she did
Well, I'm
that.
sure that helped. Yeah. So then what happened? Tell us more.
Then after the 200 session, I did what I usually do when the symptoms that brought the patient to me disappears. The bulimia was away, so I asked her if she wants to continue therapy and if she has a new motivation. And that's the moment when she said to me that she has dyspareunia. That is a pain and contraction in the vagina that made her sexual life impossible.
Okay. And and what happened then? What
So we continue our work, rage, she continued to discharge rage, but slowly this rage became hatred toward her mother and was very, very strong. You have to say that, to see that she has changed as a person. With rage, she became more assertive, no longer depressed, no longer shy, strong, happy, I would say, and with hatred, even more. And then something changes. Slowly, she began to be very ashamed during session. You could see that her body wanted to do a movement, but she was ashamed of doing it. So it took several sessions before she dared to do this movement. She arched her back, the arms along the body, the head retracted, yelling very loud and very rageous. This was the arc de cercle, in English, arch of a circle.
Okay, so, the picture that's there, why don't you describe it? What was that?
This is the arch of a circle. It was very known in the 18th and 19th century to doctors at that time. Uh, it is no longer so because today doctors don't see patient on the couch. Patients take medication, so it is rare to see this movement. You see it very often in medical organ therapy, and it is nothing else than a pelvic no, a very primitive no, expressed through the pelvis.
Mm. And she's also talking and yelling at this point too. Is that
Exactly.
correct?
She's yelling no, she's discharging her rage and her hatred toward her mother. And interestingly, with this bodily expression, her dyspareunia began to dissolve.
Wow. So then what happened?
In discharging the contraction of the pelvic floor and of the vagina through this primitive expression, she was at the root of her problem. The contraction of the pelvis due to the repression of this movement, the arc de cercle. What it is interesting in medical organ therapy is also the simultaneity between the defense and the impulse. In this case, a pelvic no was defending a pelvic yes. And what was a pelvic yes? Slowly she began to express the opposite of the arc de cercle. That is, she longed her arms, she tilted the pelvic very slightly forward, the head a little back, longing for her mother. This was the pelvic yes. And in expressing this by crying, calling her mother, uh, she discharged even more of this pelvic contraction, and the dyspareunia disappeared.
Amazing, amazing. Yes. Um, and she got relief.
She got relief completely. Yes.
Yeah. So how many sessions was this?
This was approximately 300 sessions.
Wow. Wow. And I guess one of my questions is what made her dare to face that shame and those feelings? What was it?
I think it was the contact with me. Slowly, she could trust me. We met 200 session and 250 sessions. She knew me very well. So slowly she could dare to do this movement. And this is very interesting, very interesting. This shame against something very intimate, like a movement of the pelvis.
Mhm. And it really you're describing this really portrays how the mind, the psyche, and the body, the soma, express something and and together you were able to get at both of those, both what she was feeling and what was in her body with the pan,
Exactly.
the arc de cercle, and it's very, very dramatic, and I know, I sometimes would see the arc de cercle in children when I worked in pediatrics, when the children were in the hospital and they had to have blood work done, labs done, and they did not want the lab works drawn, and they were being held down while we drew the labs, but they would take that arc de cercle and they would say, "No," these are little 5-year-old children, 6-year-old children, and screaming, "No, no, no," and, it was very painful to watch, and then after they were done, then they would reach for the mother and put their arms out in the embrace and seek that comfort and that warmth and that they weren't getting during the procedure. It was very dramatic, and painful. But then the children, they looked like they were okay once they were able to express the no and then be able to reach for their mother and hold on to something, someone that would comfort them and love them. That love impulse came out. Uh,
You
so
make me remember that I had the fortune to see also the opposite. In a child, I had a 3-year-old child that began to show this longing for her mother, and suddenly she contracted, she became harsh, aggressive, she showed the arc de cercle, and she became aggressive toward her mother. Now you come to take me. Fortunately, the mother didn't accept this aggressive way to ask love and refused. And the little girl went in tantrum that lasted 45 minutes. And only after this incredible temper tantrum, she was able again to softly long for her mother.
Wow. Wow. I mean, I've worked with women that have
You
had
could
this.
see there the transformation of the natural love, longing into the arch of a circle, into the harshness and the negativity.
Yes, yes. And you were aware enough and had enough contact with her to be able to know where she was in that dynamic of the love impulse and the hatred and the no, the pelvic no. I have several women that I've worked with that have had dyspareunia, and, they clench their fists, they bite down on their jaw, and that it comes out in many different ways. They hold their breath, and they kick, and it helps discharge that no, and then they're able to relax and breathe and curl up and then reach out, and sometimes in sessions, they would reach out and wanna hold my hand, just as a reassurance, and it's very young. It's usually related to, earlier childhood memories and trauma, sexual abuse and, physical abuse and neglect, so, um, you know, this and I think you're right about medication. Many patients are on a lot of medication, so we don't see the arc de cercle as much now because people are kind of cut off with the medication. I mean, medicines can help, but they can also cut off someone's ability to express themselves if they feel disconnected or numb. So I've seen that too. Um, so anything else that you might wanna say, to our audience, about this patient and the 300 sessions. That's pretty dramatic. But would you and we could take some questions, if you like, from the audience, but anything you would wanna say to the audience?
I want only to point out the uniqueness of medical organ therapy in treating such disturbances, the uniqueness in approaching body and mind.
Mhm. Yeah, good. Okay, let me see if we have any questions. Yeah, looks like we have a few. Um, so yeah, one question is, do males display the arc de cercle in therapy? Good question.
Sure. And they have also an equivalent of dyspareunia. They have prostatitis, they have pain in the perineum. They suffer also of the same chronic contraction, and they also get, they can dissolve it in medical organ therapy after many sessions.
Do you've treated men with this problem?
I have a couple of patients that have this problem, yes.
Uh-huh, I've not seen that. Okay, that's a great question. Good. Yeah. So one member of the audience wants to know how much time was there between each session?
Usually the patient came once a week, but I have patient that comes every 2 weeks, patient that comes every 3 weeks, depending on their circumstances and their interest and their
Mhm,
decision.
mhm. So it depends on what the patient can do and, um
It's clear if you come only once every 2 months, you will need more time because that counts is the number of sessions.
Mhm, mhm. And another question, and we kinda touched on this, but why did it take 300 sessions?
That's a good question. 300 session looks like it's very much, but it's not very much. We are dealing here with a very primitive emotion, an emotion of a very little child, probably 6 months, 1 year. And to arrive there, you need a lot of time. You have to think that uh, uh, medical organ therapy doesn't make you express mechanically an emotion that you don't feel. You cannot tell the patient, make the arc de cercle in yell. She doesn't feel it, it's not spontaneous, so it doesn't make any difference. But to arrive to such a deep feeling, you need a lot of time because you have to go through all the layers of her life and of her character. And that's need a lot of time.
Yeah, and I think, the word spontaneous, that's the key. You can't force some of this, that's mechanical, that's approaching someone like a machine, it's gotta be spontaneous, um, and that's exactly what you did with her by waiting those 300 sessions, 84 sessions and 200 sessions, and for her to work it through spontaneously on her own, so that shows, I think, a degree of health and determination in her, to get better. Um,
I can also theorize that a dyspareunia with a more not so far away original root, contraction that doesn't come from the early childhood. It can come from a trauma later in life. Surely in this case you need lesser time.
Mhm.
You don't have to go that deep.
Mhm. We have another question from our audience. Have you seen sciatica as a result of armoring? And if so, was it resolved by orgone therapy?
Sciatica means ischias, pain of the sciatic nerve.
Correct. Yeah.
I didn't see, no.
Yeah, I've not seen that, but it's interesting
I
question.
treated one case with a medical doorbuster, but this is another argument.
Uh-huh. Yeah, one question too. Did you use orgone chambers with this lady?
Organ what?
Orgone chambers. So
No.
no. Um, and
It-
another I'm sorry, go ahead.
I could have used the medical doorbuster, but because medical organ therapy did the work, so it was not that necessary.
Mhm. Mhm. Any comment about, the patient's relationship with her mother that someone's asking about?
Yes, it was a very difficult relationship, and this difficulty began when she was a baby because his mother was very cold, very distant, very harsh. Uh, and you don't need to talk harsh or to say harsh things with a baby. If you are harsh, you are harsh. And your baby feels that, and it is a tremendous pain.
Mhm. Yeah. Wow, that speaks to the health in your patient and her ability to sustain and get through and defend herself and then eventually get relief from that no and that hatred and that shame. That's a testament to the health in her. Um, so one other question, um, it says, "I got help for dyspareunia with behavioral therapy."
Yes,
Um,
as said, yes. This can be possible if the root, the origin of the disorder is not that far away. If it is a trauma that happened few years ago, it can be helpful with psychology, with behavioral therapy, and even with physiotherapy and electric approach and things like that.
Mhm.
Not if it is so early childhood origin of the disorder.
Yeah, so someone's doing a follow-up question saying, "Can you comment on the pelvic armoring so early in life?"
That's a good question.
That's a great
Yes,
question.
because yes, because the love impulse toward your mother is lived by the little child with the pelvis, with the arms, with the entire body.
Entire body.
The little child is not divided into body and mind. He is unique. And if he armor, these uniqueness begin to fragmentate, to separate. So the pelvic goes here, the brain goes there, the chest goes there. You lose the uniqueness, the unity of the body. And the pelvic is a part of the body, and it's a very important part.
So I imagine if children were treated earlier in their life, not wait until their 20s, that it would have a very different trajectory and a different expression as they grew up.
Sure, this little child that I told you that began to show the arch of a circle solved it in one session after a temper that lasted 45 minutes.
Wow. Wow. So the longer someone has this kind of armoring, it probably takes a little longer to get through it and express it, as you did with your patient. Whereas with children, it would happen, it would be resolved probably earlier and sooner, not with 300 sessions.
So we don't know what would have happened to the 3-year-old girl that I treated.
Right.
What would have happened? Did sh Could she have a dyspareunia? I don't know. For sure, her love life would have been ruined because she would have been harsh, aggressive in her love life.
Sure. Yeah, I've often wondered about the children that I worked with in the pediatric ward, whatever how they developed given what they went through as a patient in the hospital, going through tests and X-rays and procedures and labs. I've often wondered what that looks like as they're I mean, they're adults now and, the pain of that, it may be in their unconscious, but their body could hold it like your patient did. Yeah. So, last question, it looks like, how does someone get help for dyspareunia?
I can only say contact the American College of Orgonomy. Uh, that's what I would advise.
Sure, sure. Yeah, and you can contact us at www.orgonomy.org, and, you can ask for someone to approach this because it's a very unique therapy because it's approaching it with the mind, the body, the armoring, the emotions, the pelvis, the muscles, the breathing. And you have to address all of those in many patients because of the early trauma, perhaps. Um, so is there any final thing you would like to say to our audience before we close? Because I don't see any more questions. Anything you would like to tell our audience?
Again, the uniqueness of medical organ therapy.
Truly,
Unique. Yes.
you know. Well, I want to thank you so much for your presentation and the work with this patient. And I'm sure our audience will come away with learning something. I sure did. So thank you. And
Thank you, Dr. Marcel. Thank you to everybody, and see you next time.
great. Thank you. And we would like to thank our donors who make this possible. Donors to the ACO. They make this work very possible for us to continue to bring this information out to the public. And I hope you'll check out the Journal of Orgonomy on Substack and our podcast. And you can find that on different platforms, a different kind of psychiatry podcast. So you can check our website for other information. We do have our next webinar, December 13th. It's a Saturday, 11 a.m. Eastern Time, and Dr. Theodota Hasapi from Greece will be presenting on breastfeeding. So we hope to see you then, and you can check out our website for any other details. So I thank you for being with us, and have a great rest of your weekend. Bye.